Good morning, everyone. Welcome to our Monday forum session. We appreciate that you have joined us and that you have remembered to log on a Monday. And today's topic is on abuse and trauma and its impact on mental health. And if you are new to joining us, I'm Tricia Millott. I'm the county's Behavioral Health Coordinating Council Supervisor. In addition to our presenter for the day, we also have Kevin, who is my behavioral health specialist. He will be our question moderator. The forum historically has been in person and has been an annual event. This marks its fourth year. Well, 2020 marked its fourth year. And we switched to a virtual platform and have seen a lot of positives with it. We have no idea what the rest of this year will bring in terms of a 2021 forum and whether we will do a hybrid or an in-person or solely virtual. But we will begin planning that. The idea for the forum originated out of the Mental Health Action Plan, which was approved by the county board back in 2015. To really serve a few different needs. One, to reduce some of the stigma associated with behavioral health, to educate our community on topics relative to behavioral health, as well as bring some awareness and education to local resources. So we try very hard each year to make sure that we highlight different agencies throughout the community and keep most of our presenters local. With all of that, I will do a few housekeeping details before we get into introducing today's speaker. All of our questions, if you have them, please put them in the questions box in your, on my screen, it's on the right side, and there's a specific field for questions. Please keep in mind that questions will be asked of our presenters at the end of the session, so we ask that you provide context for your question. So even if in the moment you're typing it and you want clarification on something, if you would just give us a little bit of context, like, could you elaborate on childhood trauma, which should be enough context for our presenter, but keeping in mind that we ask all of that at the end. We do hope that you'll continue to join us. We have a few more sessions left. The one scheduled for the 20th is actually being rescheduled, so as a heads up to those of you who are watching today and may have planned to attend that one. The one on self-care and resilience on April 20th will be rescheduled in May, though we have not confirmed the date with that presenter yet. And then we do still have one session remaining on the specific impacts and discussion surrounding mental health with the LGBTQIA population. And that presenter is Dr. Blair Brown, and if you've been at any of our forums in the past, she has also presented there and has been well received. With that, you are all on mute, and I believe you're notified of that as you log on. So no one will be able to hear you, but again, type your questions, or if you have specific questions to myself or Kevin on more of a technical end, feel free to put that in the chat. Near the end of today's session, we will share in the chat box the link for upcoming registration for any remaining sessions, as well as the link for the YouTube channel, because all of our sessions have been recorded and are out there available for you to view. So without further ado, today's presenter is Melissa Box, who is an LCSW and clinical director of ABC Counseling and Family Services. She received her bachelor's degree in child development from Vanderbilt University and her master's degrees in social work and human and community development from the University of Illinois, Urbana-Champaign. She has 10 years of experience helping families heal from trauma. She has received training in play therapy and is a licensed sex offender evaluator and treatment provider. Melissa specializes in working with young children and their parents to reduce trauma-related symptoms and process abuse, neglect, and adoption issues. Melissa is completing her master's in public health with a focus on the prevention of child abuse and trauma through community education and school-based interventions. So with that, I will hand it over to Melissa and have her take the lead and share all of her knowledge with us. So thank you.
Great. All right. Thank you for that lovely introduction. I'm going to make sure you can see my slideshow here. Let me know if you can't. All right. Thanks, everybody. Thanks for being here. We are going to talk about abuse and trauma and mental health and how they are all connected. And it might seem intuitive, but I want to get into a little bit of the nitty gritty. You know a little bit about me now, and I just want to say a bit about ABC Counseling. We have been here for almost 30 years in Central Illinois. We have 4 offices in Peoria, Springfield, here in Normal, and in Champaign, Savoy area. And we really do focus on kids and families and helping them through traumatic experiences, including sexual abuse and neglect, foster care placement, adoption, and just general mental health difficulties that kids and families experience. And 2020 has been a real test of that. In case you weren't aware, there was this pandemic going on, and that has affected every single person, all of our clients, and we have seen a huge increase in the mental health needs of the kids and families in our community. So keep in mind that the COVID-19 pandemic is a form of trauma. So some of the things we're going to be talking about might trigger some of those thoughts for you as well. I also want to start with just a reminder that we are talking about hard things. And so if you need a moment, if you need to step away, if you need to take a break or go get a drink of water, or check in with yourself to see how you feel about what we're talking about, I think that's really, really important. So don't hesitate to do that, because I think we need to pay attention to ourselves and how we feel about all of this as well. So with that being said, I'm going to just touch on what we're going to talk about. Overall, we're going to go over how trauma and abuse are connected, how abuse leads to trauma, what trauma means, some definitions, and the cycles that we might see with those. We're going to talk about how trauma and traumatic experiences affect mental health. And then we're going to spend some time at the end discussing how to seek out help. When do you need to seek out help? What resources and supports might actually be helpful? And not only for yourself or your family, but also for others that you know. So that's going to be our focus today. I want to start with some definitions. Now, these are the technical definitions. These are not necessarily fully inclusive. But I want us to have a good kind of common understanding and starting point. So when we talk about abuse and what abuse means, generally accepted definition, a caregiver or a household member inflicts some sort of injury on a child or another person, or allows physical injury to be inflicted. So this injury might cause death, or it might cause some sort of disability or some negative impact on someone's physical or emotional health, right? It does not have to be physical. It does not even have to involve hands-on contact. Abuse can also include just a substantial risk of harm or risk of injury. And it can include excessive corporal punishment, right? So we're not necessarily talking about an open-handed spank, but we are talking about excessive physical punishment. Does fall into this category of abuse. And then trauma. Trauma is a really tricky thing because there have been a lot of definitions of trauma over the years. So I'm going to talk about how I think and talk about it so that we have a common understanding for today. The thing to remember about trauma is that trauma can either be a thing that happens, or it can be your experience of the thing that happens. So it might be an event that is especially distressing or disturbing, or it might be your response to a negative event. And this is where it gets really tricky, because two people might have the same experience but have very different responses. And one might react with more of a traumatic response and another person might not. That doesn't mean that it wasn't a trauma. It means that it might have been a trauma for one person. So something to keep in mind is that when we talk about trauma, there are different definitions, there are different understandings of what that means. But we might be talking about the thing that happens, or we might be talking about our perception and experience of the thing that happens. So when we're talking about what trauma really is. I want to reference the Adverse Childhood Experiences study. Some of you who might have been following the Behavioral Health Forum event might have attended the ACEs discussion just a few weeks ago, I think it was. And so you may already be familiar with this, but for those who aren't, I just wanted to draw your attention to this. This was a study from 20 years ago, maybe longer now. They've been building on this research over time. And what they found is that there are some specific experiences that can happen that they've grouped in this term of adverse childhood experiences that really have a significant negative impact on individuals throughout the lifespan. And we're going to talk about that impact. But when we're discussing what those negative experiences might be, these are some really commonly accepted examples of adverse childhood experiences or of trauma. So you'll see abuses at the top, right? We've got psychological, emotional, verbal abuse, physical and sexual abuse, as well as neglect. And most people would probably say, okay, that makes sense. Abuse and neglect is traumatic. I get it. But what we found is that there are several other experiences that tend to have similar effects on people, including death of a parent or a close relative. That can be a traumatic experience. Substance abuse in the family. Okay, so maybe a parent's substance use, maybe a sibling, someone in the household, any sort of substance abuse is a form of trauma. Mental illness. Exposure to someone with severe or serious or untreated mental illness is a form of trauma. And this next one is really interesting, and it shows sort of the age of the study because the wording on this has changed a little bit over the years. Violence toward mother. So what this is talking about is when a child has witnessed someone being violent toward their mother specifically, that has been found to have some similar effects in terms of traumatic effects as many of these other experiences. Now, over the years, the research has sort of honed in on this, and is it really towards the mother? Is it towards any parent? Is it towards anyone in the household? And interestingly, this has been pretty robust, that specifically witnessing violence toward the mother or mother figure seems to be associated with trauma. Parental separation and divorce. Now, we know that many children with separated or divorced parents function just fine, right? And that's true across this list. There are lots of people who have experienced one or more of these who are okay, right? And who do just fine. But we also see that especially a high conflict separation or divorce can be traumatic for kids and families. And having an incarcerated household member is another common one. So there's been a lot of research on these, and we're going to dig into what we find when we study some of these adverse childhood experiences. Now, obviously, these are childhood experiences, and so adults. The research with adults' traumatic experiences is a little bit different vein, but some of these dynamics are similar. So I wanted to make sure you know what we're talking about when we're talking about trauma. These are the kinds of things that affect us. And what they found with this adverse childhood experiences study, if you're not familiar, if you weren't able to attend the previous discussion, is that when there were 4 or more of these in one person's life, they saw significant negative impact on their physical and mental health outcomes. And we're going to talk about what that impact was. But one of these, you might be okay. 2, 3, when you get to 4 or more, it is really, really hard to cope with all that. And we'll talk about why. Okay, so what does trauma do? What happens? I want to talk about developmental trauma disorder. This is not in the DSM yet. There are lots of people who are advocating for it to be. But what I like about this term and kind of this grouping of symptoms is that it really takes into account how trauma affects us throughout our development, especially in early development, and what we tend to see. So regardless of what you call it, whether you call it developmental trauma disorder, or whether you just call it how trauma affects kids or people, these are some of the things that we might see. So dysregulation, for those who aren't familiar, regulation is a skill that we learn through childhood and adulthood to sort of keep us in the right range, right? Emotionally and physically. We can upregulate to kind of bring ourselves out of a funk, and we can downregulate if we're too hyped up or we're too stressed. And these are skills that we learn. When we've experienced trauma, then those skills are really, really put to the test. And what we find, we're going to talk about stress a little bit more after this, but what we find is that we really struggle when we've experienced trauma to re-regulate and bring ourselves back to where we need to be. And that stress response, where the way we normally cope with stress, and in healthy ways, suddenly becomes really, really taxed. And we'll talk about how. Other things that we see in the way trauma affects us is internalizing some negative attributions and diminished hope and expectations for life. So this might be thinking things like, oh, I'll never be good enough, right? Or I'm never going to be safe. No one will ever love me, right? I'm never going to get a job. I'm never going to get married. But those sort of that negative thinking becomes very pervasive when trauma happens. Other things that we might see, self-esteem regulation becomes very difficult. I mentioned regulation before when we're talking about self-esteem regulation, excuse me. We're talking about making ourselves feel better about ourselves. And that is something we should be able to do. But when you've experienced trauma, it's very, very difficult because trauma really gets at sort of our core beliefs about ourselves. Am I loved and cared for? Am I valuable? Am I valuable to others and valued and appreciated? And if we don't feel that way because of these negative experiences that we've had, it becomes very, very difficult to retrain ourselves to believe those things again. So this is another thing that we see with trauma. And then functional impairment. So these are key parts of our lives that we might struggle with when we've experienced trauma. So things like making social connections, participating in school, getting to work on time, right? Or completing assignments on time, or kind of like making small talk, for example. Like that might be really, really difficult for someone who's experienced trauma, and I'm going to talk a little bit about why. But I wanted to talk about this idea of developmental trauma disorder because it's very important to remember that we learn skills through childhood and adolescence, and even as adults, but especially in early childhood, we learn certain skills through our relationships with others. And when trauma happens in the context of relationships with others, we have a really hard time developing those skills and using them in healthy ways. So if you are a clinician, for example, and you're seeing problems with negative attribution, stress response, self-esteem, social relationships, social skills, school success, you should be asking yourself, what happened, right? Not what's wrong with the child, but what happened that made it hard to develop those skills. Okay, I want to talk some more about stress. So stress is a good thing generally. Stress is something that teaches our body how to solve problems. However, if there's too much of it, or for too long, or it happens over and over and over again, it becomes toxic, okay? And so then we're talking about toxic stress. And toxic stress is, for lack of a better term, toxic to our systems. And it becomes something that our brain and our body can no longer cope with, right? With normal or normative stress, I should say. Things like, oh, I have a test coming up, or I've got to get this project done on time for work, or, my car broke down and I need to fix it. That in isolation is something that is good for us, because if we have the resources that we need, we can resolve the problem, problem solve and get it done. unfortunately, when this stress is accompanied by a lack of secure attachment to safe, stable, nurturing caregivers, you don't have the resources that you need to resolve that stress and cope with it. So normally when we're stressed, you might notice things like your heartbeat, your heart rate increases, or maybe your palms get a little sweaty, or you get that adrenaline rush of like, oh my gosh, what I'm gonna do. And this is something that motivates us to solve a problem. And we're supposed to respond to that, solve the problem, and then the stress goes away. But when this toxic stress, the abuse, the neglect, the conflict, anything like that, any of those traumatic experiences, if they don't go away, or if they're too much for us to cope with, then our body's stress response gets stuck in the on position. And we are constantly stressed all the time. And what that does is it changes our bodies and it changes our brains. If you think about this last 13 months or so, at least in our country, it's been about 13 months, and we have had a lot of stress, right, as a community, right, as a country, but also as a local community. And there are elements of that stress that just have not gone away, that we've had to keep coping and coping and coping with. Parents of young children who had to do school at home, or take care of kids while also working, or people in food service or service industries who either lost their jobs for long periods of time or had to keep doing their jobs even when they weren't safe, or didn't feel safe. There is this constant stressors happening over and over. And so we have seen an increase in mental health issues because there are so many people who just keep feeling stressed because the stressors aren't going away. And so our body's stress response in those situations can get stuck in the on position. And all of a sudden your heart rate is always elevated and your palms are always sweaty, and you might have that adrenaline going all the time. And that's not good for our bodies. And it really changes our bodies and our brains in the long term. So this is sort of a good graphic of a summary of what I'm talking about. But if you think about how our bodies respond to stress, I always use the example of like, if you're on a hike and you see a bear in the woods, okay? That's stressful. And our body goes into that fight or flight mode, right? And it's supposed to do that. It's supposed to go, okay, this is scary, this is dangerous, this is a threat to me. So my brain, right, at the top, my autonomic nervous system is going to kind of send us into gear, and trigger all these other parts of my body to do different things, right? And my heart's going to start pumping more blood, and my stomach is going to use that food that I've eaten, and send that energy into my muscles. My immune system is going to go into high gear. My endocrine system is going to shoot out different hormones so that I can respond in that moment and run away from the bear. And this is how it's designed to work. But again, if your trauma is not a bear in the woods, if your trauma is every day when you're at home, you're trying to work with your kids around you, or every day when you're at home, your parents are fighting and throwing things at each other, or once a week when you go to grandma's, maybe there's some sexual abuse experience that's happening. That's a chronic stressor, right? That's toxic stress. And our brain and our bodies respond to these by just staying on all the time. And what we see is some long-term effects, not only in how our nervous system is wired, right? Different parts of our brain and our body are going to connect in different ways over time because they've learned I'm not safe. And if I'm never safe, then I always have to be ready to run or to fight. We see changes in hormones, right? We see negative impacts on the immune system. We see metabolism changing over time. And what we've seen, even is at the genetic levels, we see epigenetic changes, meaning how our genes are expressed actually changes in response to toxic stress. I'm going to skip ahead and then come back. So when all of this is happening in our bodies, right? When all this is happening in our lives, we know that there are some long-term changes. We know at a health level that when people have experienced trauma, whether that's adverse childhood experiences or something that's not in that category but still traumatic, for example, soldiers going off to war, right? Being in a military setting is traumatic for many people. So it doesn't have to happen in childhood. But when those experiences happen, the odds of obesity go up, the odds of STIs, cancer, chronic lung disease, diabetes, a lot of other physical health issues are more likely to happen when someone has experienced trauma. Okay, we also know increased probability of mortality, meaning people who have experienced trauma are more likely to die younger, regardless of what the cause is. And when you have 4 or more of those adverse childhood experiences, so when you have several traumatic experiences in childhood, you're more likely to have anxiety, you're more likely to have depression, and I'm talking significantly more likely, 3 or 4 times more likely, 5 times more likely to experience problematic alcohol abuse as an adult, 10 times more likely to experience problematic drug use as an adult. And this is correct because I've triple checked it, 30 times more likely to attempt suicide if someone has experienced 4 or more of those traumatic experiences in childhood. That's not an exaggeration. That's been substantiated over and over in the research, and there's a lot of support for these statistics. We know that trauma affects our bodies and it affects our brains. So I'm going to take a moment, check in with yourselves. I've talked over a lot. Get a drink of water because some of what you're hearing might trigger something for you. Maybe because of experiences you've had or someone you know or a client you have. So check in with yourself. Are you surprised by any of this? Do you have questions about this? How are you feeling about it? Maybe you already knew it, which is great. But I think it's important to check in with ourselves, make sure that we know how we're feeling about this, right? So that we know what we can do with this information. And then I want to talk about what this looks like. So I've mentioned substance use, anxiety, depression. I want to get into a little more specifics of what are some of the mental and behavioral health signs that we might see when someone has experienced trauma. This might not be the best way to represent this, but I like these images because I think they remind us of what these might look like. So I'm just going to start at the top left. Anxiety. Okay, there's a diagnosis for anxiety. We could go through the checklist of criteria. But keep in mind that it doesn't have to be anxiety with a capital A, right? It can just be a feeling of anxiety. That when someone has experienced trauma, they might have more anxiety. That's very common. Also panic, okay? Not just an anxiety, a feeling of constant anxiety, but also that moment of panic of, I don't know what I'm going to do. I feel like I'm going to die. That sense is more common when someone has experienced trauma. Things like hyperactivity. See the little bunny rabbit there. If you think about how the body responds to trauma, and our stress response is in that on position so often, we are primed to always get ready to go and always be hyper aroused. And so when someone has experienced trauma, sometimes, especially in kids, their symptoms get confused with attention deficit hyperactivity disorder, because what you see is a person who is just always on edge, right? And always kind of like, oh, what do I need to do? And where do I need to go? And always moving because their body is in this fight or flight mode so often. So you might see more hyperactivity. Similarly, being unable to relax. If someone just tries to lay down and rest and they can't, maybe they can't stop moving or they can't slow down their heart rate and they can't even, deep breaths don't help. That inability to relax might be a sign of having experienced trauma. That startle response, right? So someone slams a door down the hall, instead of kind of a little jump, maybe it's someone who shoots up out of their seat, right? That really strong startle response, because again, their body has learned that I have to be ready to go at any time. And this is something very common among veterans. And this is sort of the stereotypical understanding of PTSD, right? Is a veteran who hears a car backfire and their brain and their body go into survival mode, right? But this happens when it's more relational trauma as well. I'll give you an example. I had a client who, whenever his family would go to a restaurant, he would have an anxiety attack because clinking glasses and voices of people talking in groups would remind his body of some trauma he experienced as a younger child that involved people using a lot of alcohol and a lot of parties with unsafe people. And so for him, he couldn't feel safe in restaurants, right? So he would have a really strong startle response to the sound of clinking glasses. And that's something trauma can look like. Restlessness, sort of similar to inability to relax, but somebody who maybe just won't stop moving or always feels like they have to be doing something. Hypervigilance, right? And again, similar to the hyperactivity, this is someone who is always on alert, looking out for the danger, like there's always going to be a bear around the next curve on the trail, right? Digestive problems, I mentioned how trauma can affect our different systems, and digestion is one of them. Again, any single one of these symptoms does not mean someone has experienced trauma, but these are different ways that trauma presents itself. And it's good to keep in mind. Digestive problems might be someone who maybe has trouble digesting certain foods, maybe a lot of food intolerances, or it might be someone who has very slow digestion, right? Because their body learned, I have to hang on to this food, because if I don't know when I'm going to get my next meal. And our bodies learn from that. Emotional flooding. So this is when someone gets overwhelmed by really strong emotions. And this can happen among people who have experienced trauma, because when the original trauma was very overwhelming, their bodies just can't really cope with those emotions. And so this tiniest little trigger can sort of overwhelm them with those feelings. So emotional flooding is something that can happen after trauma. I'm going to skip back to the left side again, sleeplessness. And again, lots of people struggle to fall asleep or stay asleep, especially if maybe you don't have the best bedtime routine. Maybe you're looking at your phone in bed or watching TV in bed. So we're not just talking about, oh, I have trouble falling asleep sometimes. We're talking about, and I'm not talking about necessarily insomnia, although there is overlap for sure. We're talking about problem sleeping when someone has experienced trauma. Might be, again, they feel like they can't relax and just rest because sleep doesn't feel safe. Or maybe they fall asleep very quickly, but then they sleep very fitfully. Maybe they're waking up often, or they wake up at the slightest noise, or maybe they have bad dreams. Very common with trauma. Hostility. And I'll talk hostility and rage, which are just different degrees of a similar issue. This is, some people respond to trauma by trying to protect themselves and lashing out a little bit. And so if you're seeing, especially in kids, but it certainly happens in adults too, if you are seeing a lot of hostility or a lot of anger that kind of explodes, sometimes that is something that we have learned as a way to survive what we've experienced. And it can be a protective mechanism a little bit, not necessarily a healthy one, but it can, because our bodies have learned, if I fight back, if I show anger, maybe I won't get hurt. And that is sometimes where that comes from. So there's usually, we often talk about anger as an iceberg emotion, meaning you see anger on the top, but most of what's underneath the water that you can't see is not so much about anger, and there are other feelings underneath there. And often with trauma, it's fear. So sometimes anger is a cover for our feelings of fear and anxiety or grief. That's a big one too. Which leads us into depression. Depression, again, depression with a capital D, meaning the actual diagnosis, and you check off all those criteria, yes, that can happen. We also might just be talking about depression with a lowercase t, right? Feelings of depression, feeling down, feeling a lack of energy, feeling those negative internalized beliefs about ourselves. I'm never good enough, and I'm never going to get out of this job or house or whatever it is. That depression is a very common experience, mental health experience after trauma, because when traumatic experiences and specifically toxic stress overwhelm our systems, then our brain and our body learn, I can't do anything about this. I can't escape. And so we learn to be depressed because we don't know what else to do in that situation. Headaches. I'm right in the middle. I know this is a lot on one slide, but stick with me here. Headaches are another very common kind of side effect, I guess I would say, of trauma. And again, it's stress. One of the things we know, I mentioned earlier about how stress can affect the immune system. And when your stress response is switched on all the time, you're more likely to experience a lot of inflammation in your body. And there's a lot of science to back this up, that not only short-term inflammation, but also chronic inflammation, which can affect headaches. It can also affect, blood vessels in your body and other parts of your body as well, because your immune system senses a threat and it goes into overdrive, and it sends white blood cells everywhere, or it sends fluid everywhere as a way to try and protect itself when it doesn't really know how. And so sometimes that inflammation can lead to headaches, and some people just get stress headaches, right? Migraines, but those are more common when someone has experienced trauma. Flat affect. This is another protective mechanism that people develop when they've experienced trauma, because our brains and our bodies learn that we can protect ourselves by putting that mask on, right? And maybe if I just hide all the emotion, or if I just squish it all down and ignore it, right? Because I can't deal with what's going on, maybe I'll feel better. And so oftentimes what you'll see is a lot of flat affect. And someone looking from the outside, like for example, a teacher or a supervisor at work, might just go, that kid's pretty chill. Or, oh yeah, they don't really show a lot of feelings. They're just very calm and, fly under the radar. But what you're actually seeing is a lot of emotional numbing, right? Because those feelings are just too hard to deal with. Lethargy, this goes along with depression. It is a criteria for the diagnosis, but lethargy in and of itself, just a total lack of energy. Your battery's empty. You can't get out of bed. It's because our bodies are so tired of fighting for a sense of safety or a sense of control, and every once in a while we just run out, and so we do see. And there's hormonal things that go along with this, right? So if you are got a ton of adrenaline pumping through your system, all these hormones going, okay, run or fight or yell or hide or whatever it is in response to that trauma, at some point, your pituitary gland can only do so much, and your other glands can only do so much. So they just run out until it can replenish. So you'll get those dips of really lack of energy. Touch sensitivity. This is a really interesting one, more common among people who've experienced physical or sexual abuse, but not exclusive to them. But this is something where, again, our bodies are on high alert so much that the slightest brush of a feather, or maybe something that tickles like a hair or some grass, can really set off alarm bells in our bodies. So again, if someone says, oh, I don't like the feel of X on my skin, or I don't like the wind when it's windy out, or whatever it is, if we're sensitive to certain touches, or certain touches from people, right? So I don't like when people touch my shoulders or touch my leg or whatever it is. We really need to pay attention to that, because that is our body saying that particular thing is a stressor for me. And often it's because there might have been some trauma associated with that. Exhaustion, not just that lethargy, lack of energy, but a chronic tiredness from trying to deal with everything. And I'm on the last row here. I know this is a long slide, but I think these images really give us a good picture of what trauma can look like, mental health and physical health wise. So we see freezing, right? So if you see a kid or an adult all of a sudden just kind of freeze, that's a trauma response often. So it's a protective mechanism. This is something that goes back, like evolutionarily speaking, right? This is something that we've learned that can help us survive. And it can sometimes help us survive. But with the freezing, I think, this is where people in your life, right? Or people in your client's life, or your child's life really need to know what that looks like, so they can be attentive to, oh, they had a trauma response, they froze, they didn't react, right? And again, like for teachers working with kiddos who've experienced trauma, teachers need to know, oh, they're not just being stubborn, they're not ignoring me, right? They're not trying to be disobedient, right? They are having a trauma response, maybe because someone dropped a book, or maybe because someone was calling them mean names at recess. They freeze, right? That's trauma. And teachers need to understand that and be trauma informed in their teaching. Chronic fatigue, a little sloth there, right? Just constantly just moving slow, not being able to keep up. This is definitely something that's more common among people who have experienced trauma. The last few, disorientation, right? Getting confused about where we are, what's going on. Remember, trauma affects the brain and how different parts of our brain and body are connected. It changes those neural pathways. And so disorientation is a really common response, because our brain all of a sudden goes, wait, I know I've been here before, but because something has now wired me differently, I don't recognize this, or I'm confused about, now, where did I put that? Or wasn't I just in this room? And we all have those moments, right? Why did I walk into the kitchen? I don't remember. I got to go back. That's typical. Disorientation is really about losing sort of that connection of understanding where you're at in the room or in your body. Proprioception, which is this sense of where our body is at in space, gets very disrupted when some forms of trauma happen, especially in early childhood. And so if you're working with a client who maybe like always runs into things, right? Or just has butterfingers and can't hold on to something, or always bonks their head on stuff, there might be some developmental trauma that happened that really threw off that development of those proprioceptive skills. And it can look like disorientation. Dissociation, and this can mean a few different things. What we're talking about is a disconnect, right, between our brain and our bodies. And so this might be feeling disassociated from our bodies, right? Some people might describe floating outside their body, looking down at themselves, or it might feel like they feel disconnected and go, whose hands are these? These don't feel like my hands. It can also be a disconnect from reality, right? So we might check in with, where you are, what's your name, what day is it? Those kinds of things. What's my name and where did you just come from? Those kinds of questions we might ask to see, are we seeing some dissociation here? Or people can completely dissociate from reality and have maybe a full flashback to what trauma happened. They feel as if it is still happening because their brain got so overloaded and it just replays it on repeat. This is a criteria for a PTSD diagnosis as well. But it is something that we should be, as clinicians, checking in with, and also as parents, teachers, other professionals who work with kids, paying attention to. If you've got a kiddo saying, oh, I just had a bad dream in the middle of class, when you know they were awake, these are things to pay attention to, that maybe there was some trauma that happened. Pain. Pain is such an interesting concept. And there's a lot of really interesting research in terms of pain. So a lot of people who've experienced trauma will report unexplained pain. Stomach hurts, head hurts, my arms and legs hurt. And we as professionals have to be really careful not to minimize that because sometimes there's a real thing going on, right? Or sometimes it is a cry for help. Right? It's a sign that my body is telling me something's wrong. And our brains and our bodies are very closely connected. And for people who've experienced trauma, a lot of times what happens is if they're not able to cope with the emotional piece, it comes out as physical pain. And so you will see someone who says, oh yeah, my dad just died, but I'm okay. It's just my legs have been hurting a lot this week. Or like, I'm having a lot of back pain. I can't figure out why. Yeah, I was in a car accident, but the doctor checked me and my back's fine. But sometimes that pain is a symptom of emotion. The physical pain can be a symptom of emotional pain. Or there legitimately is a new connection that was made because of the traumatic experience that creates pain, right? We see more fibromyalgia in people who have experienced trauma, which there's a lot of interesting research about why that might be. But the point is, don't minimize that pain, right? It's a sign that something is wrong. Low blood pressure. Don't quite understand. We don't quite understand why, but it likely has something to do with the body's trauma response, the stress response. We see more problems with low blood pressure among people who've experienced trauma, and poor digestion. So having digestive issues and just not digesting food as well. So this is not an exhaustive list. I know it was quite a long list and a long time to spend on one slide, but I like these examples because I think it's important for us to keep in mind that trauma does not always mean just one thing, right? And no one's going to have all of these symptoms. More likely, someone who's experienced trauma is going to have 1, 2, 4, 6 of these, or they might have 3 on one day and 2 on a different day. But the thing to keep in mind, the big take-home message, right, is that trauma affects our brains and our bodies, and we're going to see it years, decades later. Okay, I talked about the impact of trauma on health. I just want to touch on really quickly trauma over the lifespan. And this is sort of summarizing what I've talked about before. When trauma happens in childhood, down here at the bottom of the pyramid, even before birth, right? Because trauma affects unborn children. It affects their immune system development. It affects their physical development, the connections that their brain is building. We see how trauma affects children in the womb. So even before birth and those childhood experiences, what happens is it causes social, emotional, and cognitive impairment, right? Social skills are poor, emotional regulation skills are more of a struggle, cognitions are more negative, and therefore they're more likely to adopt risky behaviors, right? So this is why we might see someone who has experienced trauma more likely to use substances, more likely to break curfew, more likely to drive above the speed limit, right? More likely to have unprotected sex, right? Not necessarily because they want to do these things or are trying to be difficult, but they have missed a lot of those steps of learning healthy social skills, healthy emotional regulation, healthy cognitions, and so they're more likely to make poorer decisions. And these, therefore, can lead to social problems in adulthood, long-term disease, disability, and more likely to lead to early death. Now, this is getting a little dark. I don't want you to give up hope, because we also know that people are very, very resilient. And we know that health is a dual continuum, meaning just because there is adversity, just because there is trauma, does not mean people can't be healthy and successful. And just because there is not trauma does not mean people will always be healthy. Right? It's not a one-to-one ratio. There's a health continuum and there's an adversity or disease continuum. And so what's important and what more and more of the research is showing that's so encouraging is that positive health can exist in the midst of disease and adversity. And the key there is that safe, stable, nurturing relationships need to be present. Okay, so even if someone has 4 or more ACEs, when they have safe, stable, nurturing relationships, the impact of those adverse experiences goes down dramatically in very significant ways across the spectrum of different domains. So what this is resilience. We're talking about resilience. And for those who maybe are clinicians in practice, you know this word. More and more research is focused on sort of the positive power of resilience in adversity, not just let's stop the bad things from happening, stop the trauma or prevent it, but also how do we build up these positive things and build up resilience so that even when negative things happen, even when trauma happens, that we have the skills we need to cope with it. And what we find in the research is that when those key elements of resilience are there, this includes things like self-regulation, school or family or peer support, when children and adults have natural interest and curiosity that's encouraged and facilitated, when you see persistence through adversity, when we build those skills, those resilience components, it creates a buffering effect that protects people from the effects of trauma, even when trauma happens. Okay, so don't give up hope, right? Trauma probably is going to always happen. And unfortunately, abuse and neglect and all of these other bad experiences are still going to happen on some level. But we know that if we build up those strengths and those social supports and those self-regulation skills and the interest and curiosity and persistence in individuals, we know that they can also overcome that trauma. And those safe, in the context of safe, stable, nurturing relationships, it's incredibly powerful. So I just want to touch on when and how to seek help. Questions to ask yourself. If you are not sure whether you need assistance with trauma or mental health, excuse me. Questions you might want to ask yourself and check in with yourself. Are you noticing patterns of behavior that cause problems for yourself or someone else? Right? This doesn't have to be big stuff. It might be little stuff. Don't wait until there's a crisis. Do you notice a pattern, right, that's causing the same problem over and over? Are we having the same fight over and over, right, which we usually do with our partners? The same arguments over and over. Are you noticing these patterns of your own behavior that are causing problems for yourself or someone else? Are you experiencing emotions that you can't control or manage? Emotions are normal. We all have feelings. We all have strong feelings sometimes, and they're important. We need to have feelings because it clues us into something needs to change, right? Anger is a clue that something's wrong, right? Hurt, sadness, grief is a clue that something bad might have happened. We need to pay attention to those feelings, but if we can't manage them or you feel out of control, it might be a time to get some help. Are you encountering negative consequences in your work, in your family, or in a school setting, right? Are you seeing over and over, I keep getting written up, right? Or I keep missing work, or I keep getting in the same fight, or I keep failing? Maybe there's a sign we need some help, right? Are you feeling some of these big feelings, right? Disconnected, depressed, anxious, angry, confused, or afraid more than you feel is typical for you, or more than you feel is appropriate? If you think that this is more than I can handle, it probably is. And finally, are you noticing memories or flashbacks of past experiences that are bothering you? Memories are normal. Even some sort of like moments of, oh my gosh, I just smelled walking in this hallway. It smelled like my high school cafeteria, right? That's normal. But is it bothering you, right? That's a good time to reach out. If we're talking about a child, questions to ask about a child. Are they experiencing new problems in school? Something new that hasn't been going on before? Might be a sign that something happened and they need to talk about it. Are they avoiding spending time with family and peers? And, not or, because if any of you have a teenager or a preteen, or have ever had a preteen or a teenager, you know there's a period of time where they want nothing to do with their family. That's developmentally typical, not something necessarily to stress about. However, if they're also avoiding time with peers, you might want to be concerned. Because then where are they getting that social support and interaction from? And they can come back to the family stuff. You'll get through those years. They're just hard. Are they having more trouble sleeping than usual? Have you noticed changes in eating habits, hygiene, or communication patterns? Again, if you have a preteen, you're going to be like, check, 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 check. Don't panic. Just check in with them. Are they displaying chronic problems with pain, with eyesight, hearing, or toileting? Remember, with children, trauma looks different and sometimes is more somatic, meaning it's more about what the body's doing and less going to be kind of mental or linguistically expressed. So keep that in mind, that if a kid keeps talking about pain or keeps saying they're hearing things or all of a sudden is having bathroom issues, there might have been something traumatic going on. And are others who know them well expressing concern about the child? So maybe you think they're fine, but maybe a neighbor who babysits them every day is going, they're acting off this week. Pay attention to that, right? There might be something going on. Options for support. I put these here top to bottom because some of these, if you're familiar with Maslow's hierarchy of needs, have to be in place in order for mental health treatment or any other behavioral health services, substance use treatment, things like that, can really have a lasting impact. Housing needs to be stable, right? Financially supported, or at least stable, right? Meeting the basic needs. Childcare needs to be taken care of. One of the few things that has been shown to prevent child abuse and neglect is reliable childcare for parents. And you think about this past year, and how so many families have not had that. We've seen abuse and neglect increase, right? So keep in mind, parents need childcare in the society we live in, right? Where parents have to work in order to support themselves. Childcare is really key. Now, if you've got those top three in place, then you can look at substance use treatment. Then you can look at the physical and mental health care. Those are really key also. But most people aren't going to be able to address those consistently without the top three taken care of, right? So keep this in mind. And then tutoring and educational support and employment, those are higher level needs, right? They need to be met for sure. But somebody's not going to be able to go to class every day if they're having flashbacks or they're maybe addicted to something they have to use every day and they don't have childcare. So think about the different levels of intervention. Start with the basics, right, and move from there. Watching our time, I just want to throw out there some resources if you want to learn more about trauma, about abuse, about mental health. These are some great websites, tons of free resources and trainings. And I'm sure Trisha can help you guys out in terms of getting these either access to this slide or to all the slides, so you don't have to write them down in a panic. We will make sure you get these if you're not familiar with them. But some great resources here if you're interested in learning more about this. My big takeaway message for you is that we need to work on multiple generations at a time, right? We need to help the parents and the children because the parents often already have had the traumatic experiences. They need help to process those so that they aren't parenting out of their own trauma and repeating this cycle. So make sure that when you're working, if you're a clinician, you're working with families, you're thinking about both generations or 3 generations or more. Make sure that you're thinking about intervention after things have happened, but also prevention before they happen. And I am going to stop there and hand it off back to Trisha, because that's all I've got for today.
Thank you so much, Melissa. And to all of our attendees, again, if you have questions, feel free to put them in the questions box. We have Melissa until 12:15 is what we're scheduled for. So there's plenty of time left to ask any questions of her. And I just want to thank you for giving such a thorough presentation. And I think the most, at least even on my end, and even as a person who has served in the clinical world and works with a lot of this, I think the slide that shows the potential like physical and emotional impacts of trauma with all of the little images is one of the most impactful that you included. And also easy for people to understand oh, that thing I'm experiencing, that rage that doesn't make sense for the situation may make sense because of X, Y, and Z that happened with the child. And so I want to thank you for all of that information, as well as tying in the piece of resilience. And I know you and I have had this conversation, as have some other folks in the community, but the role of really building up some of those strengths and some of the protective factors that can move us forward rather than staying so focused on the trauma that's happened. I will also add, while you all take time to think of whether you have questions or not, is that Kevin has thrown out in the chat box the links for upcoming registration, as well as the YouTube channel, which is where you can not only find this presentation, and I usually say give us about 24 to 48 hours to get it uploaded. Sometimes it takes a little bit longer from GoToWebinar to actually get it back for us to be able to do our part. And then sometimes, based on our demands and what our workflow is like, it is actually on our part that it takes us a little bit of time to get it out there. But we will have it out there, which also means you will have access to that last resource slide that Melissa referenced.
We do have one question. Roll in real quick. This is from Joyce K, and she would like to know, is overreacting, would that be a result of trauma, or could that potentially be a result of trauma?
Well, anything could be a result of trauma, let's be honest. But I think if it's a pattern, right? I think we all have our moments, right? We all have our bad days. We all have our moments, especially as parents, or, you know, if we're just having a rough week, maybe you have a cumulative stress, right? A lot of bad things going on at the same time. And so give yourself some grace, right? And maybe you're not talking about yourself, but give each other grace as well, that we all have our moments. And I think if you can come back and recognize, oh, I overreacted, and do some emotional repair work in the relationship, it may not be a trauma response, but if it's a pattern, right? If it's something that over and over, I seem to overreact to situations, there might be something more going on. And so I think it's good to explore. I always recommend therapy, but with someone that you trust, that you're open to feedback from, whether that's a therapist or a partner or a family member or friend, to go, hey, I've noticed this about myself. You know, do you notice this? And what is going on here? Why do I do that? Right? And exploring what's my mental and emotional state before the thing happened, whether we're talking about overreaction or we're talking about maybe we always just run away from hard situations, right? Whatever your pattern is, or whatever your client's pattern is that you noticed, if we are seeing this and can go, okay, what was it about that situation that really set me off? And sometimes the easiest way to do that, the safest, best way to do that, is in the context of a therapy setting, because I think you can, with a really supportive professional, you can really dig into what's going on underneath, if there is something going on underneath. So yeah, I think paying attention to the patterns is really important.
Thank you. Great answer. We have another question here from Morgan, who says, you mentioned art play and therapy. Can you tell me what things you look for in play that may signal trauma?
Oh, this is someone after my own heart. I love working with young kids, and play therapy is really, really helpful. So how do I condense this into one answer? One of the things that we look for when we're looking at children's play is kind of themes and patterns. So I'll take preschoolers, for example. Many of them will do good guys, bad guys, right? Superheroes and villains, and someone's trapped and we have to rescue them. And it's very, very common. I wouldn't worry about that. One of the things we might look for is a persistent storyline over and over that isn't changing and isn't resolved. So if you've got the bad guys always win, right? Or the good guys always get hurt and there's a sense of hopelessness or a lack of resolution or a persistent lack of safety for the characters in the story, that's something that I might, as a clinician, go, okay, like this isn't resolving the way a typically developing child sees in their stories, right? In the movies and the books and the shows that kids are exposed to, the good guys win. And so if kids are not having good guys win in their play, you might want to ask some questions. So that's something that I would say you could look at if you're interested more in the play therapy piece. I strongly recommend the Association for Play Therapy website, which is a4pt.org, or the St. Louis Institute for Play Therapy, which I mentioned because it's just a couple hours from here, which you can find at stlipt.org. St. Louis Institute for Play Therapy. They have a lot of great trainings, some at the more basic and intermediate level and some more advanced. So if you're interested in that, I recommend those resources. But that's a huge field right now, especially if you work with children. I wish I could spend another hour talking about that. Feel free to reach out if you want to talk more about that. I'm happy to discuss further.
Okay. We don't have other questions pending right now, although we'll still give folks a chance to type something in case they do. I wonder, Melissa, if there's anything else that you either want to throw out there as a result of the questions that have come in, or something that has come to mind after your presentation that you want to take time to share.
Yeah, I think I will just speak to, because we talked about this briefly before it started, the issue of racial trauma as trauma. This is something that people are becoming more and more and more aware of. Well, I should say some people are becoming more aware of. Some people have known the whole time that there is such a thing. And so keep in mind that I didn't list this as an example, but trauma from racial discrimination, race-based violence is another form of trauma. And so as a clinician working with people of color, make sure you are thinking about that. Make sure you're asking about that in sensitive ways. Maintain your cultural humility to know that you're not going to always understand, we're not going to always understand how race has played a role in the lives of our clients, but that is another form of trauma I didn't specifically address here, but keep in mind there's generational trauma for people of color, Native Americans, things like that, that we can't ignore. And it wasn't specifically addressed here, but I just wanted to throw that in just in case.
All right, well, since we have not received any other questions and we are close to our time, I will wrap up. And just thank you again for your presentation today. And I anticipate for those who are watching that we will probably have some other partnership with Melissa for a presentation in the future, just because she and I have already started dialogue about what that may look like, and we'll keep you posted. That's one of the lovely things about GoToWebinar is that we have email addresses so we can keep you informed of upcoming sessions or new forums or ventures that we decide to take on to promote community education. So Melissa, I thank you for giving your time today and helping impart knowledge on all the rest of us. And I hope that you all have a good day. So thank you again.
Thank you so much for having me. This was such a pleasure. I appreciated the opportunity.
All right, thank you.
Bye.